Hello everyone. In this INR number 97, we are going to discuss one important PYQ, that is congenital rubella, right? So congenital rubella is also known as German measles or third disease, and it is caused by Toga virus, right? What is Toga virus? It is a enveloped single-stranded RNA virus. So now you can see there is a envelope which is made up of lipid bilayer membrane, and there is a single layer of the RNA. So this viral genome is single stranded RNA, right? And incubation period is usually 2 to 3 weeks, and if you take an average, approximately 18 days. And patient will be infective 7 days before and 7 days after the rash starts, right? So this is important. So 7 days before and 7 days after the rash it will start, they will be having infectivity. What will be the route of transmission? So route of transmission is by droplet infection through the respiratory route or via transplacental vertical transmission. So you can see in this rubella infection routes, right? So it can be via respiratory droplets. The person is, sneezing and then he is transmitting this, and it can be also from that mother who is affected, so who was pregnant, so from there to placenta and then to the unborn child, right? So this is how it will be transmitting. Remember, this occurrence of the transmission is during maternal infection occurs mostly during the first trimester of the pregnancy, right? So remember that it is a very important to understand maximum fetal transmission if infected between 6 to 8 weeks, right? So first trimester, 6 to 8 weeks more precisely, right? If infection occurs after double of the 8 weeks, means after 16 weeks, no major abnormalities will be there. So these 2 points you have to keep on remembering for your exam point. So maximum infectivity is in first trimester, especially within 6 to 8 weeks, and this will be causing no major abnormalities if it occurs after the 16 weeks, right? So what are the abnormalities? There are classical triad of congenital rubella syndrome. And what are the classical triad? Number one, you will see eye, ear, and heart. These are the three things: eye, ear, and heart, right? So what is in the eye? You will see the congenital cataract and salt pepper retinopathy. So now you can see rubella cataract, you can see the opacity of the lens, rubella cataract bilateral, congenital cataract, and in this you can see salt pepper retinopathy is present in the retinal or fundus examination. Congenital heart disease, they will be having patent ductus arteriosus. They can have other congenital heart disease, but PDA is the most common one. Remember, most common cardiovascular abnormality in the rubella syndrome is the PDA. This is the PYQ. And deafness will be sensory neural deafness. Remember, sensory neural hearing loss will be there. And this is again a very important PYQ. This is the most common clinical finding and most common sequelae in the congenital rubella. Most common clinical finding as well as most common sequelae. Another important thing you will notice here is the skin lesion, which is a blueberry muffin rash. So this is called blueberry muffin rash, which is a distinctive rash present as a blue, purple, or dark spot. So you can see this is looking like a dark or purple spot, which will be present on face and body both places. And for diagnosis, you will be seeing IgM in blood at the birth. So when this baby will be born, and IgM antibody, that will be diagnostic of the rubella infection. And treatment will be usually there is no need of the treatment, and they are self-limiting infections. So keep revising this topic. These are very important, and best wishes for your exams.